And welcome to our Friday Roundtable. Hot topics of the week. We're going to talk about it with Terri Yurek. She is the owner of Terri Yurek Insurance Services, Inc. Jan Ronis, the law offices of Ronis and Ronis. Jan, welcome back.
Thank you.
And of course, Rory Pendergast has been here many times,
yes,
also a lawyer in San Diego. Thank you. Nice to see you.
Yes,
and let's talk about, first of all, obviously the Obamacare issues continue to boil with the president saying, 1,000 times we're going to save $2,500 for a family of four, an average American family. Premiums are skyrocketing, a complete contradiction to what the president promised when this thing was before Congress. Terri, you're hip deep in this stuff. What do you think?
Oh yeah, well that was all a bunch of baloney from a socialist. But the truth of the matter is there's going to be this big bailout, and you know what?
Tell me what that means.
What that means? Well, you're talking about
who's going to be bailed out?
The insurance companies have been paying reinsurance fees. The public is paying that. It's kind of like having, reserves when you have life insurance companies. Okay, so that money is there. We're all paying into it. So, we're going to go back and draw on that money to support this system. We all knew it was not a short-term fix. This is a long-term fix.
You're telling me that he's trying to mask the premium increases by funneling billions of dollars to the health insurance company.
Correct.
Jan Ronis, this sounds bad.
Yeah. Well, first of all, Obama's not a socialist. And secondly,
I've been
a real strong supporter of the Affordable Care Act, otherwise known as Obamacare. I think the underlying principles to for example, allow people with pre-existing conditions. The other, highlights of that, it's a wonderful program. There may be some expenses associated with it. We're not going to know probably till 5 years down the line.
Implementations has sucked, Jan.
Well, I'm sorry.
Well, I don't know.
It's true. That's true.
It's been very tough. But I tell you what, any sort of huge social change such as this, in which it is a social change, which was necessary, a changing healthcare, how we were at, was necessary.
Without the Affordable Care Act, the change would not have been forced. And he's right. We needed the change. We need a guaranteed issue. I mean, I can tell you, I sat with clients, families, taxpayers, try to sell them insurance. They couldn't buy it. They couldn't qualify. I've worked in this industry for so long and watched these insurance carriers narrow down plans and make more exclusions and make higher out-of-pocket maximums to try to keep it affordable. But then, we're just paying more and more out of our pocket. With essential benefits, at least we're getting a decent plan. We're getting,
and so now it's a matter of
basic care, immunizations for children, things like that.
Can. Right. And when you look at this, with how great it is that, it is, the dust is there. And just because it's been implemented for a couple months does not mean that it's going to be, that the dust is going to clear. It's going to take years to figure out what's going on. But in the end, mark my words, it's going to be the best thing for it.
In the end, mark my words, come November, the Democrats are going to get shellacked on this thing because it is punishing more Americans with higher premiums and more exclusions and deductibles than it is helping with these subsidized rates. Am I wrong?
You are wrong. You are wrong somewhat. Yeah, I have to say that because no, the plans have gotten better.
Can we get that one?
No. Yeah. So no, the insurance plans have gotten better. The plans of, I call it the old world.
The deductibles have gotten bigger. The premiums have gotten bigger.
But you're talking about all the basic care that's now in all of the plans. You have your essential benefits. You have immunizations for children. You have, well care and preventive care. Solving this problem is talking about getting more access to these, just to basic general care, primary care practice providers to manage chronic illnesses and, to do these things and have performance measures and, cut out this fee-for-service baloney, cut out this, get malpractice reform and cut costs.
Let me transition. Because if Obamacare is going to work in the long run, the VA has been around for decades, and it's not working so well according to what we've learned this week, have we not?
Well, listen, what's been reported is outrageous. However, the VA has worked quite well for decades. There are VA hospitals all over the country. You're having some problems reported from a few, and what's being reported is really, it's repulsive. However, it's worked well. What's occurring, I believe, is, for example, the aging Vietnam veterans are now starting to take advantage of the program. We've had 2 wars that were unfunded and ill-conceived, and they've been thrust upon the VA, and the VA hasn't been able to respond with as much speed as they should have. So the chickens are coming home to roost.
Jan, I'm sorry. Barack Obama came in fully briefed on the fact that during the Bush administration there were 3 audits of the VA saying, look, they're hiding their statistics, they're not taking care of veterans, veterans are dying waiting for care. They knew all this in 07, 08, and they had a transition team was fully briefed on it. And Obama responded. He's nearly doubled the VA budget. They've opened up clinics and hospitals all over the country with this thing. They employ, it's the biggest bureaucracy other than the Department of Defense that we have.
But I agree with you.
Still, they're doing double waiting lists. They're cheating on all this to get bonuses. The bureaucracy is huge.
I think what we need to find...
And 27 deaths, according to an internal VA report. Forget the IG, the Inspector General. 27 deaths have been attributed directly to this kind of double dealing. That's outrageous.
As awful as that is, however, that's not unique to the VA's hospital system. This occurs all over the country. It shouldn't, and it doesn't. These are politically sacred cows of veterans, as they ought to be, and it obviously hits the press far more than the kinds of deaths you see in hospitals every week.
In the regular hospital. You know, I think the biggest thing we have to look at here is this, you know, removing the idea of that this is a political issue, because as you said, you know, this was going on when there was a Republican in charge. This is going on right now, so I have to figure out why. What is going on? You know, I read some reports saying
that it's a unionized bureaucracy.
Because it's a unionized bureaucracy.
Of course.
You
can't fire anybody.
I saw something, you know, now I tell you what, although I am pro-union, I tell you what, you know, I see the House gave, they're trying to give the VA director more powers now to look at what the 450
and the Senate
people
Democrats
who
won't
are
pass
right
that bill.
there, the 450 people who are right there, that's what we have to look at. How do we get it better? What are the systems that we can put in place to make this better?
All right, when are your Democrats going to pick up that bill in the Senate then and pass it and give the director, give Portiansecki some authority?
You know, I was just on the phone with him right before we got here, but we didn't
I
quite
hope
get
you're
to that
successful.
one. We didn't quite get to that one.
Right. Yes. You know what? I just think it's just appalling. I mean, you know, the whole thing, all these, you know, men and women who have fought for our country, they are in these hospitals.
And is this a preview of Obamacare? This is a government bureaucracy.
People like to say that. I somewhat disagree to that. You know, I think that I think there's some VA hospitals that are like up here in the highest standards.
San Diego's one of them.
Absolutely. So, you know, there's good doctors, there's bad doctors, there's good dentists, bad dentists. I mean,
in Chicago at the VA hospital.
Yes. Well, that's
there's
another bad one.
4,200 people working at that hospital. There are 309 doctors. This is an insane bureaucracy. It is unionized. It is untouchable. You can't change the work rules. You can't change their assignments. You can't, as an administrator, you have no authority whatsoever. It's an out-of-control government bureaucracy, and I'm afraid that it's the precursor of what we'll see if government ever goes to single payer.
I disagree, because
I hope we never go to single payer.
Under Obamacare, they're not establishing government-run hospitals all over the country like the VA has. It's still going to be privately.
But Reid and Obama have said they want to. They want to go to government single payer.
Can they do that?
Single payer is different than government hospitals.
No, but single payer is taking the so-called private hospital and say, okay, I'm your customer.
Well, Medicare, listen, I'm a strong proponent of Medicare. It's worked wonderful for 40 years, and it's a sacred cow that the people on Medicare are happy with and wouldn't change. And it is basically privately run,
it's a voucher.
government funded.
And you know, this is my answer. Let's try to see if we can pull this together. Because here's my answer to all of this. Why don't you do for the veterans what we did for them in the GI Bill for education purposes? You get a voucher, you go to the place of your choice. Instead of a giant bureaucracy of government-run hospitals, cancel all that and give people a voucher to go into the private healthcare system and get done what they need to get done. Why wouldn't that work?
We don't need this whole Affordable Care Act to get health care reform. Okay, I am not a proponent of Affordable Care Act.
It sounds like you are.
No.
It sounds like you are.
It sounds like what you want.
I believe in health care reform.
Something had to happen.
I know something had to happen to make a change, and you know the Affordable Care Act forced that. Now, do I believe in all that other garbage language that's in there that's making a lot of other changes that aren't necessary? No. Okay. So I agree with you on that. Okay.
All right. What about vouchers? What about just going with the GI Bill approach?
So what you're saying is you want to shut down the entire VA system,
right?
And just put it to vouchers.
No, but put it like we did the GI Bill.
Okay.
Give them the power. Give the veterans the power to make their own choice, to go to something that might be a lot closer than the VA hospital. A lot of rural areas, and Pelosi was talking about this yesterday, a lot of rural areas don't get service because they have to go 40 miles to the...
Hey, I come from Montana. I come from a rural area.
There you go.
Right?
You know what I'm talking about.
Not only do they have to travel for that, but you want a doctor. You want your primary care physician.
Right.
You don't live in the city, man. You're out there.
Right.
So that's not going to resolve the kind of the
well, what about the GI Bill approach?
So what you're saying is just get rid of... So I guess the question is this. So you're just going to get rid of all the VA system?
Close the government hospitals, sell them off. Do it manufacturers. Sell them off.
You're very good with numbers, I see. So close them up. How many hospitals? How many doctors? How many people?
And that would go immediately into the private sector. And that would immediately be responsive.
I know where he's going with that.
Well,
I love it.
the private sector's, hospitals are having trouble dealing with the people they're dealing with right now. Imagine if they had to assume, the care of hundreds of thousands of veterans.
No, but these hospitals would stay. They'd obviously be sold to private operators.
It doesn't sound bad. But imagine how long that would take to implement.
Hasn't the GI Bill worked? Hasn't the GI Bill worked?
Yes, it's worked. It's educated. My father went to law school in the GI Bill from the Second World War.
Exactly, mine did too.
All right.
Exactly so. So I'm wondering, as we look at this, though, let's talk politics because we only have a couple of minutes left. City council races are coming up.
Yep.
City council races determine whether Kevin Faulconer is going to be an effective mayor or not because of the veto powers. Either going to be the Democrats being able to override the veto, or whether Kevin will be able, with the veto, to keep the city council and him working in sync. With the 6th district and 2nd district, we've got Lori Zapp and Chris Cate ahead, but are they ahead enough to get 50% in June?
You know, I don't think they are. I don't think, I mean, the Zapp Boot race, that's going to be close, but if you look at it, Sarah Boot has got a lot of supporters, and you go out there on the weekends, man, I'm saying there's 50, 60, 70 people at her campaign on the weekends, knocking on doors, making phone calls. That's a big support. Now, Chris Cate, I don't think there is. I think there's about, what, 5 or 6 people in the race right now.
Yeah, a lot.
I don't think District 6 is going to get the 50% plus one.
But it might happen in 2.
But well, no. Now and then here's the other
You're
thing.
saying it doesn't happen in either one.
I don't know. I mean, hey, if I had a crystal ball, we could go make some money off of this. We go to Vegas.
You're supposed to make good guesses here. That's why you're on.
Well, listen, I'm going to defer. Not living in the city, I can tell you what I hope will happen as opposed to what I think is going to happen. I just don't know. But you know, listen, I've been watching from a distance. I've been happy with the Democratic-controlled city council. I hope it continues, and I think
you're in favor of raising the minimum wage.
Yes.
You're in favor of the Barrio Logan plan?
Yes.
Yes, absolutely.
Okay, well, Barrio Logan plan's going down in June. Terry.
Good. Well, I'm glad to hear that. But yeah, I am in favor of minimum wage, and I am against the Barrio Logan.
I'm in favor of the prevailing wage.
That's what I'm in favor of.
I'm in favor of $100,000 a year for all of us.
Themselves or be responsible for their community update, and not the city as a whole be responsible for the community update, or two very powerful groups throwing tantrums, trying to get their way.
What are you going to say, and I understand that point of view, but what are you going to say in Claremont when, for instance, the community plan comes up and says, no, you can't put density around those 2 trolley stations where density is necessary to help that system really fund itself, and the community goes, you're not going to put high rises in my view from
But is that what's happening right now? I mean,
yes, it is. Well, so if the plan comes up and the community wants no low density, freeway-oriented stuff, and the planners and every old liberal say, hey, wait a minute, you've got to put density because that's how growth's going to occur, then are you going to let the community prevail then?
Well, you know, what
no,
it comes
you're
down
not.
to, I'm going to let the community.
Come on.
The community is going to make the decision. Now, is it going to be something as simple as that? I don't think so. The Barrio Logan plan, 5 years, 35 years from the last time.
And they want to put 6-story buildings next to the freeway, which is the biggest source of pollution.
Hey, those buildings are going up there. It is not the biggest source of it. What you're comparing automobile emissions
the EIR,
to actual
toxic
chemicals.
The facts of the EIR are that the biggest source of air pollution and asthma-causing stuff is that freeway and
then
not
let me ask you this
the
one. Why is it
But
that
not the
off the
tall
805, off the 163 in Claremont, Kearny Mesa, where you have all of these highways, why is it still that the Barrio Logan kids have 2.5 times the rate of asthma? Why is it that those kids are going to it? Could it be the chrome plating areas that are right next door
is not there
to
anymore.
the,
APCD
right
got rid of those guys a long time ago.
To the schools?
Chrome plating is gone.
It next to the toxic chemicals? And
Rory,
next to the schools?
you're making a 1985
all
argument.
they're asking for is a one-block buffer.
You see what's at stake? It's going to be a fun election. Thanks you guys for showing up. Jan, Terry, and as always,
And
Rory.
I think we will take it.
You're still doing it, aren't
We will take it.
We have to leave. He'll keep going. I'm Roger Hedgecock for UTTV.